Hi everybody, it's Dr. Alfonso coming to you again from the Bengtson Center for Aesthetics and Plastic Surgery. This is our second webinar this week to keep people interested and to educate people in terms of some of the questions that may have about surgery. So today we're going to talk a little bit about breast augmentation. It's one of the most common surgeries in the United States, usually number 1 or 2 each year in terms of its popularity. There's a lot of myths and sort of misbeliefs out there in regards to breast augmentation surgery that people may have preconceived beliefs about. And so today, one of my goals was to talk to you really about the science of breast augmentation and what the surgery entails. So obviously, surgery is very popular because there's a lot of women who want to improve the shape and volume of their breasts. And the most common way that we do that is by putting in an implant. So if you look here, I have a silicone gel breast implant. This is by far the most commonly used implant in our practice and even across the United States. This has been used for many years. We're on the 5th to 6th generation of implants that have been around for quite a few years, and they've really refined them to the point where they're some of the best used medical devices. So most women who come in for breast augmentation would like to have more roundness, more fullness, a better shape, and a big improvement in cup size. And during the consultation here at the Bengtson Center, what we do is assess a patient's tissues, how loose their skin is, how stretchy their skin is, and then really work with them to create a plan for surgery to pick the right implant. One of the neat aspects of our consultation component is doing the Vectra 3D imaging. And this literally allows patients to look at their before pictures and then simulate with the computer, adding the volume of the implant in, what they would look like after the procedure. And we've noticed over time, using this for many years now, that this really gives an accurate picture once patients have actually had the surgery and healed and the swelling has come down in terms of how they look. It's a really neat thing for patients to be able to see what their body would look like simulated on the computer screen after having the surgery before they actually have the surgery. Some of the other new advancements in breast augmentation revolve around the recovery. Again, we do what we call a fast-track breast recovery, which involves patients getting medication before surgery to help with their pain. In surgery, we do the technique most often through the scar under the breast because it gives us the best access to put the implant in the position that we want it to be in and make the space or the pocket as accurate as possible. And that's really important for long-term benefits. We try and do the procedure with very minimal bleeding, and right after surgery we have you up and moving your arms back and forth to keep your muscle moving. We almost always put the implant under the muscle or partly under the muscle because long-term studies have shown that it gives the best results as well as has the lowest risk of complications. The surgery itself is about an hour or so, and then recovery time, patients are in the recovery for about another hour to 45 minutes and then home. So it's done as an outpatient procedure here in our accredited surgery center. And follow-up is about a week to 10 days out. No drains, no big bulky dressings, a very small steri-strips over the incision, and we place patients in a bra. Sometimes patients will wonder, well, what size implants do you use? Everyone's different. It's really based on a patient's goals, what size they would like to be afterwards, and how much their body can tolerate, because we don't want to put in an implant that's overly large in someone. Long term it can cause issues. Implants are very helpful in this process because they come in different projections, meaning that some are rounder and then some are flatter. And that helps a patient basically have the ability to choose with the surgeon's input what implant would be best for her based upon her desires, whether they want to be a little bit rounder over the top part or a little less round and a little bit more smooth in the upper part of the breast. Overall, the procedure is one of the most popular ones, and patients really do have great outcomes, and the process we feel here has been a great improvement in order to allow patients to truly get a sense of what the surgery is going to be like and their recovery. Light exercise is allowed in about 10 to 14 days. We typically tell patients to get up, walk. The night of surgery, if you want to go out, grab a bite to eat. We're all in favor of that. Arm motion is okay. The only real limitations are heavy lifting and any muscle activity with your chest area. I hope this was informative for you and it stimulates some thoughts and questions. Again, we have our email dedicated for patients asking questions during this kind of time frame where our office is closed down. It's askothesurgeon@bcaps.com, bcaps.com. And one of us will get back to you in a relatively short time frame regarding questions, anything related to breast augmentation or other procedures that you might have an interest in. That's it for now. We hope to follow up with everybody next week with some more information. Take care and be safe.